in 3 seconds.
Okay. Good morning. Recognizing a quorum of commissioners, I call the December 28th, 2022 meeting of the Cannabis Control Commission to order. This meeting is being held remotely pursuant to Chapter 22 of the Acts of 2022. Commissioners Concepcion, Roy Stebbins, and myself, Chair O'Brien, are participating in today's meetings. All votes taken today will be by a roll call vote, and the meeting is being recorded. The items on today's agenda are to discuss and vote on expiring COVID-19 orders, namely telehealth, curbside pickup, and virtual community outreach meetings. Do any of my fellow commissioners have any statements or comments they wish to make at this time? Hearing none, I'll ask, oops, sorry, go ahead.
I was going to say, Chair O'Brien, this is Commissioner Camargo. I'm here, just in case.
Thank you, and Commissioner Camargo, thank you very much. I know this is inconvenient, so I'm glad that you've been able to make it. Thank you. Any comments that anyone wishes to make? If not, Mr. Collins, Executive Director, do you have any statements or comments that you wish to make?
I do not. Thank you, Madam Chair.
Okay, I will now turn things over to you, the Executive Director, for a presentation on telehealth consultations.
Thank you, Madam Chair. Good morning, Commissioners, and thank you for your time this morning. Briefly explained, we talked at our last December public meeting that there are a number of COVID-19 related administrative orders and accommodations that would be expiring at the closure of this calendar year. So this week, December 31st of 2022, as those items were not posted to the Commission's meeting for December, we thought it important to properly notice them, allow for a fulsome discussion, and give the Commissioners some space to make a decision. That said, we are culling information and trying to compile as much information as possible to help inform that decision. I do have some anecdotal information that might be helpful just to provide some context. At the same time, I think it's important that we dig a bit further into these matters. They have been extended by the Commission's vote historically. As you know, COVID-19 as a declared public health emergency actually expired, I think it was in June of last year, perhaps. So these things have been extended as a courtesy, but not something that I would think or believe that I enjoy the authority to extend myself. Telehealth extension, for clarification, is for those initial first visits. Our regulations do allow for telehealth visits for renewals, but this would be for that first initial visit and certification for a patient. It is actually through a waiver granted to the provider so that they may conduct that visit through the use of telehealth. Curbside operations is available at this point only and exclusively for medical marijuana treatment centers, so therefore just a service available for patients. In virtual community outreach meetings is an ability we've afforded to licensees and municipalities for that initial application. As you know, it must occur within 6 months of someone filing their application. And what we've done historically is we've actually tied it to the Commission's ability to meet remotely. In other words, so as to not be hypocritical, if the Commission's are able to meet remotely, then we believe that perhaps licensees or at this point applicants should have that same ability. That said, it must be approved under the order, consented to, by the community. It must be recorded. There must be a neutral or third party moderator of that meeting. There must be the ability of constituents or residents to submit questions in advance and have those questions answered. And then finally, that recording must be uploaded to us as part of the application, but also to the community in the event that that community wants to share that information, for instance, to their local cable access. So all of those things, again, are things that perhaps could be extended. For just some early data we've been able to pull, throughout the course of last year, we issued 22 telehealth waivers. We also had some that were automatically extended by nature of the waiver, of the order being extended. That said, it's a small universe. I do believe that many patients are enjoying the benefit of telehealth. Again, it is a waiver that's granted to the provider. In this instance, if the Commission chooses to extend it for even a temporary junction, we would automatically extend those existing waivers as well, not require folks to reapply for a waiver. Curbside operations, Again, an informal survey of licensees indicates that about 30% or 30, given that we have 100 functional MTCs across the Commonwealth today, about 30% are still utilizing curbside. There might be plenty of anecdotal reasons why that number seems low to me. It could be that folks are co-located, and so the adult use operation alongside an MTC, it can certainly be confusing for folks visiting the facility as to who may actually enjoy curbside. It also may just be physical layout of the facility, how to accommodate a curbside operation in perhaps a downtown setting, for instance, versus a large enough parking lot. And for virtual community outreach meetings, over the last 6 months, our licensing staff was kind enough to survey and evaluate the last 6 months of applications that we saw, and about 48% of applicants utilized virtual community outreach meetings. Again, so that's just the information we've been able to pull since our last public meeting, hopefully informing your discussion today. I'll stop there in the event there's any questions or comments that commissioners may have.
Commissioner Concepcion, and you're on mute.
Thank you so much. Good to see you all. Mr. Executive Director, can you just repeat that last figure? It's 48% of who was able to utilize our virtual outreach meetings?
48% of the applications we've received within the last 6 months.
Okay, thank you.
Sure.
Any other questions, Commissioner Roy?
Thank you, Madam Chair. Thank you, Mr. Executive Director. So it was 30% of MTCs were utilizing curbside, 48% utilizing the virtual community outreach meeting. What percent used telehealth for the initial visit?
That's a figure we don't have. So I indicated that there were 22 waivers that were granted over the last year. For, I guess, some context there, the medical use of marijuana operating system does not capture telehealth as a check the box was telehealth utilized in this instance. And the rationale for that simply historically had been it's not a permanent allowance. Therefore, we're not going to make structural changes to the system. Obviously, it's been with us long enough that had we done that at the initial confrontation of COVID, perhaps we'd have a little bit better data now. At the same time, we chose at that point, this was a temporary allowance. We're not going to make structural changes to the system.
So just to follow up on that, so if we have 400 plus providers, what you're saying is only 22 of them filed for the waiver?
That's not what I said. It's 22 waivers over the course of the last year. Waivers that were previously issued were automatically extended. So we're still compiling that information at this point.
Okay, thank you.
That said, too, it's a good point though, which is there's two questions that raises for me. One is total volume of individual providers, because some providers may have applied for waiver as part of a practice group, therefore applying that ability to the total practice. But I don't believe that it would cover every provider. So it raises some compliance questions for me, frankly. Are folks offering telehealth without the benefit of a waiver? And that's obviously something we'd want to follow up on too. And I'm not trying to paint with too broad of a brush. It's the next step of a evaluation we have to make.
Just one
Commissioner Ray, go ahead.
Question. What was the mindset at the time when you said that first visit had to be in person? Can you explain what the commissioners, if you can put into context for us, why they embedded that in the regs and why it was important?
It ultimately stems back to the lift and shift concept of the migration from TPH to the commission, and also the statutory requirement that there be a bona fide relationship established between the provider and the patient.
Thank you.
Commissioner Stebbins, you had your hand up.
Sure. Thank you, Madam Chair. First of all, I think just to acknowledge, I think we all received a copy of a letter from the Mass Patient Advocacy Alliance. So certainly appreciate their feedback so quickly after our last meeting. Mr. Executive Director, the 30% that are still utilizing or appear to be utilizing the curbside pickup, is there an opportunity or ability to figure out where they are relatively geographically? I'm just thinking of other ways that patients might be able to also access their prescriptions, you know, either via delivery or what have you. But do we have a sense of, or could we plot this out as to where those 30 are?
That is something we can, and I think we're intending to do. Again, I want to be clear. I'm not presenting this information as complete to you. I'm sharing what we've been able to compile since the commission's last public meeting. So it would be my intention to provide you in fact, I was under the impression that was today's discussion, was to provide that opportunity of how much longer do we need to build out that case. So yes.
Right. And I was just, this is, I think these are, important questions that are being asked right now, but, just reminding the commissioners that with our earlier conversation, we wanted to give our staff enough time to actually gather a little bit more of this information to make a determination as to whether or not this is something that we just extend for another period of time, whether we consider this in, our regulations to make some of these notions permanent. And so, that's why we're meeting today to just make sure that we don't abruptly end these opportunities for people, but also we have a time certain within which we're going to make a determination about this either temporarily again or permanently. So that's why I don't know if there are any other questions right now, but I don't want to get too deep into the weeds on the issues, because I think that we still need to give our staff some time to dig into some of this a little bit. So maybe, we've raised some good questions here. Executive Director Collins, I think he gives you, some idea and direction of what the commissioners are thinking. I don't know if anybody has, Commissioner Camargo, I don't know if you have any questions or if anybody else, but I just want to remind us, because there's a lot that we could dig into here, but I just want to make sure that we remember that we're just postponing this deliberation until February. Does that make sense for everybody? Okay. So Commissioner Stebbins?
Sure, Madam Chair. So would it be appropriate to extend these 3 deadlines out through the end of the month of February? And that would give us time at both the January and, if we needed it, the February meeting to make some decisions on these. Would that be a fair timeline for folks to think about?
I think what we were thinking about, and again, if the commissioners would like to, we certainly can discuss this in January. But what I was thinking is that we would, and this was in consultation with the executive director, when we were putting together the agenda, thinking that we literally would extend these deadlines until the February 9th, 2023 meeting, but we certainly can ask questions at both the January and the February meeting. But I really just wanted to give the staff, or I wanted to suggest that we give to the staff until February to pull a lot of this together, unless you think otherwise. So if you have any other thoughts on that, I'd like to hear that. Mr. Stebbins?
Yeah, so just so I'm clear, so you're thinking we extend these 3 deadlines till the date of our February meeting?
Yes. I think that this, in determining what the agenda would be for the January meeting, in consultation with the executive director, I just wanted to give them enough time to be, and obviously we have the December meeting. In the last several years, we haven't had a December meeting. So we also have the holidays in between the December meeting and the January meeting. So I just wanted to give our staff enough time to provide us with more in-depth and thoughtful information that they can gather for us to make a decision as to whether or not we extend this again, we make it permanent, we talk about it in terms of the regs. So I just wanted to give them enough time, or I suggest that we give them a little bit more time to come up with feedback on this. Does that make sense to the other commissioners? Does anyone else have any questions or comments on this issue? If not, I will ask the commissioners for a motion to extend the current December 31st, 2022 expiration of the Commission's COVID-19 order for allowing telehealth consultation for patients dated June 17th, 2022 through February 9th, 2023 public meeting date. And again, I'm taking these separately. Commissioner Roy, do I hear a motion?
So moved.
Commissioner Concepcion, do I have a second?
Second.
Do the commissioners again have any questions or comments and edits to the extension? Hearing none on the motion that's been seconded, I will take a roll call vote. Commissioner Camargo?
Aye.
Commissioner Concepcion?
Aye.
Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
The chair votes aye. Let the record show the motion was approved with 5 in favor and none opposed. Commissioner Executive Director Collins has taken up all of the issues in one, but I'll take the next issue in order, talking about curbside pickup. I will ask the commissioners for a motion to extend the current December 31st, 2022 expiration of the commission's COVID-19 order for allowing curbside operations for medical marijuana treatment centers effective July 1st, 2022 through February 9th, 2023 public meeting date. Commissioner Stebbins, do I have a motion?
So moved.
Commissioner Camargo, is there a second?
Second.
Do the commissioners have any questions, comments, or edits to this extension? Hearing none on the motion that's been seconded, I will take a roll call vote. Commissioner Roy,
Aye.
Commissioner Camargo,
Aye.
Commissioner Concepcion,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. Let the record show the motion was approved with 5 in favor and 0 opposed. And again, now we'll take up the virtual community outreach meetings. I will ask the commissioners for a motion to extend the current December 31st, 2022 expiration of the commission's COVID-19 order for allowing virtual web-based community outreach meetings effective July 15th, 2022 through the February 9th, 2023 public meeting date. Commissioner Stebbins, is there a motion?
So moved.
Commissioner Roy, is there a second?
Second.
Do the commissioners have any questions or comments or edits to this extension? Hearing none on the motion that's been seconded, I will take a roll call vote. Commissioner Camargo,
Aye.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
The chair votes aye. Let the record show the motion was approved with 5 in favor and none opposed. Do the commissioners have any final questions, comments before I request a motion to adjourn? Mr. Executive Director, do you have any comments that you'd like to make at this time?
Just thank you and Happy New Year.
Thank you. And that was going to be my comment. Happy New Year to
Sorry about
everybody.
that.
Happy New Year.
That's okay. No,
Happy New
you
Year.
can't say it enough. All right, so I will entertain a motion to adjourn. Commissioner Roy,
So moved.
Commissioner Concepcion, will you
Second.
second that? Thank you.
Second. Yeah.
Thank you. I will take a roll call vote. Commissioner Camargo,
Aye.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
The chair votes aye. Let the record show the vote has been 5 in favor, none opposed. And I will announce that our next meeting is January 12th, 2023. The commissioners will be meeting in person, but we still will be organizing a remote option for people to attend those meetings remotely. Thank you, everybody. And again, Happy New Year. And I hope everyone had a wonderful holiday and that you get a little more time to reflect and get ready for the new year. We've got a lot of work. Thank
Happy
you.
New Year,
Thank
everybody.
you. Happy New Year. Thank
Happy
you.
Bye.
holidays.